Hello everyone, welcome back to Blocking the Flame, Anakinra and COVID, the podcast that explores how targeted immunomodulation intersects with infection, inflammation, and innovation. I'm your host Gaganasri, and today we are shining a spotlight on the drug at the center of our series, Anakinra. What is it? How does it work? And why is it gaining attention in immune-driven diseases like COVID-19? To guide us through the science, we are joined again by Aseema. Welcome back, Aseema.
Thanks, Gaganasri. It's great to be here again. And this is where things get exciting, like Anakinra is a really fascinating molecule.
Like always, let's start with the basics. What exactly is Anakinra?
So, Anakinra is a recombinant form of the human interleukin 1 receptor antagonist. In simpler terms, if I say it mimics a naturally occurring protein in our body that blocks the IL-1, specifically IL-1 alpha and IL-1 beta. These cytokines are major drivers of inflammation, and Anakinra acts by preventing them from binding to their receptor, that is IL-1 R1, on immune as well as non immune cells.
So it doesn't stop IL-1 from being produced, it just stops the message from getting through.
Exactly. Think of it as intercepting a message before it reaches its destination. Anakinra binds the IL-1 receptor without triggering the downstream signaling cascade. That means less activation of inflammatory pathways like NF, kappa B, and fewer inflammatory mediators overall.
So typically, how is it administered in clinical settings?
It's most commonly given via subcutaneous injection once daily. In intensive care settings or clinical trials, intravenous routes have also been explored for rapid effect, but subcutaneous delivery is still the standard and in most inflammatory diseases.
Okay. So now let's get into how the body handles it. What do we know about Anakinra's pharmacokinetics?
Okay, so it has a short half-life, about 4 to 6 hours, which is quite different from many other biologics. That short duration allows for quick dose adjustments, which is useful in case of acute or evolving conditions. And it's cleared mostly by the kidneys, so dosage needs to be monitored in
And,
patients with renal impairment.
and in terms of onset, how fast does it start working in inflammatory diseases?
Well, it can act pretty quickly, especially in diseases where IL-1 is a primary culprit. In conditions like Still's disease or macrophage activation syndrome, patients often see improvements within a few days. And in some COVID-19 studies, biomarkers like CRP and ferritin have decreased within just 48 to 72 hours after starting Anakinra.
Okay. Previously, you mentioned it blocks both IL-1 alpha and beta. Why does that dual action matter?
That's a good question. So, IL-1 alpha is released early from dying or damaged cells, sort of like an initial distress signal. And IL-1 beta is actively secreted by immune cells after inflammasome activation. By blocking both forms, Anakinra acts broadly, interrupting the inflammatory process at both the initial injury signal as well as the immune amplification stage.
And what are the current medical indications for Anakinra?
It's FDA approved for conditions like rheumatoid arthritis and neonatal onset multisystem inflammatory disease or NOMID and DIRA also, which is a rare genetic disorder. Clinicians also use it off label for a range of inflammatory syndromes, including macrophage activation syndrome, Still's disease, and more recently, COVID-19 related hyperinflammation as well.
Yes, which brings us to the key link. How did Anakinra become part of COVID-19 treatment conversation?
So during the pandemic, doctors noticed that a subset of patients with severe COVID developed signs of macrophage activation or cytokine storm like syndromes. And given that Anakinra already showed promise in treating similar hyperinflammatory states, it became a natural candidate for clinical trials. Researchers wanted to see if modulating IL-1 could reduce the immune mediated damage which was seen in those patients.
We'll definitely dive into those trials in the next episode. But to close today, why should we target IL-1 specifically when there are other inflammatory cytokines like IL-6 or TNF alpha?
IL-1 is upstream in the inflammatory cascade and it can trigger the release of other cytokines as well, including IL-6 and TNF alpha. So, blocking IL-1 is a bit like closing the floodgate at the top of the stream. Plus, the short half life of Anakinra gives clinicians more control and it can be stopped quickly if needed, unlike long acting monoclonal antibodies.
That's a big advantage in unpredictable illnesses. Aseema, thank you for walking us through how Anakinra works and why it matters.
Always a pleasure, Gaganasri. I'm looking forward to the next deep dive.
Next time on Blocking the Flame, we'll explore the clinical trial landscape and what's been learned from using Anakinra in COVID-19, how the results are interpreted, and what it tells us about treating inflammation in infectious disease. As always, this podcast is for educational purposes only and does not replace medical advice. Consult a healthcare provider with any health related concerns. Thanks for listening and see you in the next episode.